Good morning to all of you. In these videos, I am going to discuss about another anti-tuberculosis agents, that is ethambutol. In last couple of video, I have discussed about isoniazid and streptomycin. So this ethambutol is denoted by E and it's discovered around 1961, and it's a bacteriostatic agent and used in combinations with other drugs for the treatment of tuberculosis. And this drug is also categorized as a essential medicines in WHO list of essential medicines. This drug is included. Essential medicines. This drug is available as a generic. Uh, Drugs is available in various strengths. It is available in the form of tablets. 10 tablets are available. 100 mg tablet, 400 mg tablets are available in the market, and dose is 15 mg per kg orally once a day daily. Dose is depend upon the patient's what is its weight, what is its other conditions. So mechanism of actions of this drug, how it show the bacteriostatic action. I told you it's a bacteriostatic. So how it show, it particularly interfere with cell wall synthesis. How it interfere normally, as you know, in mycobacteria, mycolic acid is the one of the major components for the cell membrane. So this mycolic acid is attached with 5 hydroxyl group of, there is a d-aravinose residues of what? It's a residue of aravinogalactan. So this mycolic acids is attached with the 5 hydroxy group of d-arabinose residue, that is residue of arabinogalactan, right? And it makes a complex, that is mycolyl arabinogalactan peptidoglycan complex. So this complex is formed, and cell wall synthesis in mycobacterium tuberculosis is happen. This is a normal process. So how this ethambutol, as I told you, ethambutol interfere with the cell wall synthesis. So how it inhibits this cell wall synthesis? There is a enzymes arabinosyl transferase, which helps in the transfer of 5 hydroxyl group of arabinose residue of arabinogalactone. So this enzymes helps. So this your ethambutol, what it do? This ethambutol inhibit these enzymes. Ethambutol, that is denoted by E, it inhibit arbinosyl transferase enzymes. And as I told you, arbinosyl transferase enzyme is helpful for the transfer of 5 hydroxyl group of D-arabinose, and it makes the complex with the mycolic acids and do the synthesis of cell wall in the mycobacteria. So if this ethambutol inhibit the arbinotransferase, so this transfer will not happen. So mycolic acids, arbinogalactan, peptidoglycan complex will not form. Ultimately cell wall synthesis will interfere. So this is the mechanism. So how this ethambutols, so the bacteriostatic actions. Various ADRs are associated with this are visual disturbances, optic neuritis, joint pain, liver kidney problems, liver and kidney associated ADRs, red green color blindness, these are the ADRs associated with this ethambutol. And this ethambutol is contraindicated in children. Contraindicated in children. So this is about the ethambutols. Again, I am repeating, this ethambutol is discovered in 1961. It's a bacteriostatic used in combinations with other drugs. WHO included this list of essential medicines. It's available as a generic in various tablets forms in various strength, 100 mg, 400 mg. Mechanism of actions, it interfere with the cell wall synthesis, particularly it inhibits the albinosyl transferase enzymes. Due to that, mycolyl albinogalactan peptidoglycan complex will not form.